So this video is doing the closed basket weave with heel locks and a subtalar sling. So you're going to want to have the patient pull their toes towards their nose, and this is called dorsiflexion, and you're going to want to leave them in this position for this tape job, but most of the other ankle and foot tape jobs too. So you're going to start with spraying their foot with adhesive spray, and then apply a heel and lace pad. This is has a little lubricant on it. This is just to prevent any rubbing or irritation on the joint with their shoe and the tape and everything. And then you're going to want to use pre-wrap, and this is to allow the tape just to stay and protect the skin and hair that's on the leg from the tape. And you're going to start by wrapping it around the ankle and then just closing up so that no skin is showing. And then a little bit around the foot, and then come up about towards where the top of the bottom of the calf is. And then you're going to start by placing 2 strips on the top. One is going to be on this a bit on the skin, and then a bit on the pre-wrap, just to hold the pre-wrap on. And then this is going to be your anchor for the rest of your tape to come attached to. And then you're going to place another anchor around the bottom of the foot for some more tape to attach onto. And then you're going to next bring, this is what we call a stirrup. You're going to start on the medial side, or the middle side, up along where you started with the anchor, and bring it around the heel and attach on the outside. Then you're going to make sure you want to bring it tight. And then you're going to place a C-strip at the bottom of the heel to allow for protection. And then you're just going to repeat, and you're going to be wanting to go over the bump on either side of the middle and the outside of the ankle. And so you're going to split the middle side in half and bring it around so that you're splitting the tape. So you're covering that full ankle, and then you're going to place another one of those C-strips around a little higher up, so about half the tape length up to increase. You go. And then you're going to do one more of those stirrups around, but this time placing it overlapping both of them. Making sure you're pulling the tape tight. And then you're going to place another one of those C-strips about halfway up the other tape. And then to just close that off, you're just going to bring tape around and just close the rest of that area off. Starting at the bottom and working your way up. Next, we're going to do what we call a heel lock, and that's going to start on the middle of the leg, front of the leg, and you're going to bring it around the middle side and then back around the heel, underneath the heel, bringing it back up to the front of the leg. Like so. And then you're going to do the same thing, but going towards the outside. then you're going to do both sides again, locking that heel in place. Okay, and then next we're going to do a subtalar swing. So you're going to start by placing it on the middle, kind of underneath the big toe, wrapping around the outside of the foot, covering that bump on the outside, and then bringing it back up to the top of the foot. And then I'm going to do it again. This is to prevent the ankle from turning in, and so then we're going to do it the other way to prevent it from going. And there you go. You're going to start this taping technique by spraying the athlete's foot with sticky spray. Just give it a little spray along the foot. After you spray the foot with adhesive spray, you're going to place a strip of 1.5 inch tape on the ball of the foot underneath the toes, like so. And then you're going to place a strip underneath the big toe going towards the outside and then back to the fifth. And then you're going to go from the fifth around the inside of the heel back to the first toe. And this is going to help form your arch. Layering them one halfway over the other, and then you're going to do the same thing but from two around the second toe all the way around to the fourth toe, and then from the fourth toe all the way back around to the second toe. Now from the fourth toe around the middle of the foot to and then from the third toe you can go around the outside of the foot back to the third, and then from the third you're going to go through the inside of the foot back to the third. And then you're going to cover all this back up with 1.5 inch tape, starting on these strips that are going a little bit over to prevent them from causing any blisters or getting caught on the sock when the patient puts the sock back on. You're going to start by pulling them from the outside into the middle, covering each strip by half. And this is going to help really keep all this stuff down and form the arch. And you're going to go to a little bit past halfway. And there you go. So this is the donut pad taping technique, and you're gonna start by cutting a donut pad out of like felt or foam. I'm gonna use felt today, and we're actually gonna start by spraying some Tough Skin, which is like some taping adhesive to help the pad stick. So you're just gonna apply to the area. So this is for a if someone has a blister or some tenderness on their foot somewhere. So we're gonna say he has a blister around under the second toe, and this allows for the dispersion of forces around the area so that it's not tender or painful when the patient is running, jumping, or walking. So you're gonna start by cutting out a circle in the felt. And then like so, and then you're gonna cut a hole in the middle so it looks like a donut. So once you have the donut pad, you're gonna stick it on around the blister, and then you're gonna get some coverall and cut it to fit properly so the whole donut pad is covered. And then you're gonna make sure you wanna round out the edges so that when the patient is putting on their socks or shoes, it doesn't rub off. Like so. And then you're gonna want to take the edges, the paper off, and pull it tightly around the donut pad, and this helps prevent like bulkiness of using actual tape to hold it on, so that it's more comfortable for the patient. And there you go. Alright, so this is going to be the Achilles technique, taping technique, and you're going to have your patient laying face down on the table, and you're going to spray their ankle and foot with some adhesive spray, let the tape stick a little better, and then you're going to start by placing, you can use pre-wrap, but I'm going to choose not to because the patient doesn't have much hair and it'll stick better. So you're going to start by placing 2 strips at the bottom of the cast, so right around here, and these are going to be your anchors for your Elascon tape to attach to, and then you're going to place another one anchor around the middle of your foot, of the patient's foot. Okay, and so then you're gonna go ahead and measure out the length in which you want to have your Elasticon tape, about a little higher up than this, so that you, when you cut it, it can wrap around. So you're gonna use 3 of these strips, or as many as you feel necessary to get the job done. And then you're gonna just cut it like so, and then you're gonna split the tops and the bottom in half, so that way it can wrap around the foot and ankle easier. So you're gonna rip it in like this, place the bottom like that. You're gonna want to then pull the patient's foot up a little bit, so that they're almost like they're pointing their toes to the ground, and then so that way you can pull it into and decrease the length of this tendon, so that it can. And so then you're gonna pull it tight, rip it a little bit, so then it wraps around, and then wrap it around the foot, a leg like so, And then you're gonna do 2 more like that and measuring it out. And now with the second one, you're gonna place it on the bottom in the same area. But at the top, you're gonna bring it so that it's slightly below where the last one was, like so. And then 1 more. You're gonna do the same thing with this last one, except bring it a little bit lower than the last one you did on the top. Like so, and then you can fold these in a little bit to prevent any irritation. And then to end it, you're just gonna put some tapes around the tops here to allow these strips to stay and not roll up, and then again at the bottom to hold them in place. This is going to be the ankle compression wrap with a horseshoe padding, and so you're going to want to cut one of these out of a felt pad, just like this shape, and this will be placed on the outside of the ankle to promote swelling to go up the ankle and out of the get it out of the ankle. And you're going to use a elastic wrap. So you're going to place the horseshoe on the outside, have the patient pull their toes towards their nose, and then you're going to take the wrap and wrap it around the bottom of the foot, keeping a lot of pressure in the bottom of the foot, and then around the outside and back down. Throughout this time, you're going to want to keep the most tension in the base of the foot and then let it get a little bit lighter up at the top, and that will allow the swelling to go that way instead of into the foot. And then you're going to bring it back around, keep going like this, and you're going to want to keep creating this like X pattern along throughout the upwards of the ankle. And then you can either use the pegs that they give you, or get some white tape to wrap it up if you want to let them move around. This was a little easier and makes it stay a little better, like so. Any movement and help with stability in the thumb due to like a ligament sprain or injury to any area of the thumb. So you're gonna want to have the patient place their hand like they're cupping or grasping a cup, and then you're gonna start with one of those anchors around the wrist for your tape around the thumb to connect to. And then you're gonna grab a 1-inch tape and you're gonna place it around like middle aspect of the thumb, and then have this come down here, and then bring this around and almost have it like cross pretty at like the thumb joint kind of. And then you're gonna do another one, but split it a little higher up. And then place it so, and having them cross in the same place, and then you're just gonna close it off. And you can many of those spike as is necessary to limit motion, and then you're gonna want to pull in the direction you need. Capillary refill.